Hi, I'm Rachel Wall, founder of Inspired Hygiene, and I recently was speaking at the Hinman Dental Conference, and I had a question from an audience member that I thought was really great and very representative of what we hear a lot. So, as we're speaking, a lot of times our audience is full of quite a few hygienists and a few really great doctors, great dentists, and then some business team members as well, right? So this hygienist said, I'm on board with you here as far as the level of care that we want to deliver to our patients. How do we get our doctors on board? How do we get our doctors to really support us in up-leveling this care, in spending the time that we feel is necessary for a proper diagnosis, for educating the patient to the next steps in treatment? And so here is my response to that. Is the first thing I would say is to go back to what is the vision of the practice. And you can break that down even more simply by saying, Doctor, what is your vision for the hygiene department? What do you want the hygiene department to be? First, for the patients. Second, for the providers. What do you want the hygiene department to be for us hygienists? And third, what do you want the hygiene department to be for the practice? And then listen to what doctor says. So doctor may say, for the patients, I want this to be a place where they're taken care of and they feel comfortable asking you guys questions and they feel like you are their healthcare advocate. And if you hear something even remotely similar to that, if you hear we want this to be a place of overall health and it starts in the hygiene department, then that's where you have to go with, and you have to say, so we want that too. We want that too, and yet our hands are tied because maybe we don't have time in the hygiene visit to do a complete oral cancer screening and perio screening and really recording those data. Or perhaps you say, we want that too, and so what we need is your support so that when we present treatment that we feel like is in our patient's best interest, we have your back. We have your back, you back us up, and we're all on the same page and congruent and calibrated. So I would say if you're wanting to get your doctor on the same page, really look at what is their vision for the practice. And if they're not a practice owner, what is your vision for your role in this practice? What do you want to do to serve patients? And start there and see where that might take you.